Hello, everybody. This is Julia Worrell from FACE, the Foundation for Airway and Craniofacial Excellence. And I'm super excited to be able to spend a little bit of time this evening talking with you, providers. And I want to come to you from the basis of being a parent. I'm a nurse by background, and it colors everything I do. And most of the time, when I'm speaking with you folks, I'm speaking to you as providers on how we can help our patients. And tonight, I thought I would approach you from the parent side of things, because I know as a provider, if I have stress in my family, if my children are not healthy and there are issues at home, it's going to color everything that I do. And when I find solutions and I find the help that my children need, that my family needs, that I need, it makes me a better provider. I'm better able to help other people. So I thought tonight I would speak about the chicken or the egg, which came first. Because one of the biggest issues that I see for parents in the community right now is dealing with kids that have ADHD or are on the autism spectrum. And the numbers are staggering. When we look at how many children are having issues, this is a huge problem. And unfortunately, many parents and many families are struggling to deal with this on their own. And it's a huge community issue. So if we were to look at the statistics for ADHD, for example, I've got some numbers. So there's 11% of the kids out there have ADHD. And the onset by the age of 5 is severe, by the age of 7 is moderate, and 8 is mild. But that is a huge number of kids with ADHD, and 6% of those are on medication. And if we look at autism spectrum disorder, 1 in 42 boys have autism, and 1 in 189 girls do. So that's an average of 1 in every 68 kids. That is huge. And what I see in the community is families struggling to deal with the behaviors for their children, how to remain loving and kind in a situation that is putting you really to the test. And it's difficult for the child as well. I mean, it affects how they view themselves, how they're labeled in the schools. Many children don't do well in school when they have these diagnoses. So then as a parent, you're wondering, how are they going to manage as they get older? How are they going to support themselves? And what kind of life are they going to have? And I see many people struggling to get the services that their children need for their families. So some areas do provide services and some stop at a certain age. Or you get children as they're getting older and they're no longer eligible for these services. What do the parents do then? So financially, it's a huge strain on the family. And the statistics also go on to show that most families don't survive this type of pressure. So it's a strain on the marriage, it's a strain on the family, and like I said, for the whole community, this is something we need to be looking at together. So, the where I come into this and what excites me is being able to take a step back and look at the science of what is happening here. Because my concern is that the government is providing huge grants, like we're talking hundreds of millions of dollars to the pharmaceutical companies to create a whole line of drugs to treat these children. And what we've seen and what we know is that drugs and more drugs are not the answer. And I'm a big why person. If we could go back and ask, why is this happening? Why do we have such ridiculous numbers of kids struggling with these issues in this day and age? We should be getting better with the science that we have, right? We should be getting healthier. But that's not what we're seeing. We're seeing a huge decline. And I believe we have a huge opportunity to help prevent the next generation of kids from having to deal with these issues. And I'll tell you why. I'm going to start sharing a few studies that I have been researching and come across. So if we were to start with autism spectrum, for example, the correlation between kids that have autism or are on the spectrum on some sort and have a sleep breathing disorder is like 83%. That is huge. 83% of them have some type of sleep disorder, with the majority of them being a sleep breathing disorder. If I switch over to ADHD and we look at those numbers, we find the same correlation that these kids, 85% of these children that are being diagnosed with ADHD actually have a sleep breathing disorder. They're not getting sleep. They're waking up through the night several times. They have night terrors. They don't want to go to bed. And the medications that they're being given to help with the ADHD symptoms are actually causing insomnia in a lot of these kids and making the problem worse, not better. So if we look at ADHD and autism spectrum, and they are problems of the nervous system, what is it that could lead to these kids being born with or developing at a very young age these nervous conditions? So there's an article entitled Hypoxia in Utero and Craniofacial Development. And this is fascinating because we cannot do studies on live children, live embryos for humans, obviously. So the studies that were done on chickens, which is where I got the chicken and egg idea. So they did these studies on these embryos, and they created a hypoxic environment. And what they found was that depending on the level of hypoxia in the embryo, what they found was corresponding craniofacial anomalies, a spectrum of craniofacial anomalies from mild asymmetry and eye defects to more severe frontonasal and cephalic anomalies. Skull bone development was delayed in hypoxic environments, and there were skeletal defects observed. And it said that these hypoxic embryos also displayed an increased metabolic stress response, and that it led to a problem with their nervous system, and that this was found to be across the board. So depending on the level of hypoxia the embryos experienced, the worse their symptoms were. So when they started looking at women that were pregnant that were at risk for a hypoxic environment while the baby was developing, they found similar responses. And they concluded that intrauterine hypoxia is one of the most significant clinical challenges facing the obstetric practice today, and that it did affect not only fetal growth, but also muscle tone, craniofacial development, the ability to suck. It affected the respiratory system and the nervous system, and they found that these children had neurological problems following them right up to the age of 6. They followed these children and found that it progressed with them. Moms tended to have preeclampsia, and the baby had abnormal growth and neurological difficulties. So what's interesting is that oxygen is a nutrient in our body, and the body decides, which nutrients it can pass on and which it needs to keep. So when the mom is pregnant, even if she's not eating well, even if she has hyperemesis, and she's not getting many nutrients, the body will take the mom's nutrients from her body, will leach it and give it to the baby. So the baby is protected and the baby is fine. But the only nutrient that the body does not do that with is oxygen. It preserves the oxygen for the mom and for the moms to stay alive. So the resulting hypoxia crosses over to the baby. So if we were to take 40% of the oxygen that a mom breathes in for the mom, 40% for the placenta, and 20% goes to the baby. If that mom becomes hypoxic, then it corresponds that the placenta will become hypoxic and the baby gets very little oxygen. And what we see in that hypoxic environment is the beginning of craniofacial distortions, facial asymmetry, poor muscle tone, which leads to problems with sucking and breastfeeding later on, poor neurological development, and poor respiratory tone. So putting these things together, Dr. Stephen Park, who is amazing in the world of sleep, He has an article called Sleep Apnea is a Craniofacial Problem. And he outlines very clearly that the babies that are being born now are being born with constricted airways from craniofacial distortions. And this is where FACE tries to pull together the pieces and the science to help us to understand the why behind why our children are dealing with these issues. So, if we want to look at reducing the numbers of kids with autism and ADHD, we need to start with the mom. We need to make sure the mom has plenty of oxygen and that the baby is getting enough oxygen. And this can be ascertained as early as 12 to 14 weeks of gestation, which is very early. So with the Doppler ultrasound, they can detect if there's any changes in the vasculature from hypoxia. So as a mom, as a nurse, as a friend, when I see people who are pregnant, the first thing I'm going to be concerned about is, are they oxygenating well? These studies were done on women who lived in high altitudes and who just would normally have low oxygen levels, and that's going to be an issue for the baby. But they were also women who had cardiovascular issues and defects of their own. The studies need to be done on women with sleep breathing disorders and whether their sleep apnea is leading to problems in our children. And maybe the mom doesn't have sleep apnea when she's first pregnant, but what we see is as she puts on weight, as the fluid levels in her body increase, as the hormones change and she has more lax softening of her muscles and her ligaments in order to prepare for delivery, well, then her airway becomes more collapsible. So if she's not even thinking of it at the beginning of her pregnancy, it's something we as providers need to be commenting on and watching for throughout her pregnancy to make sure that baby is getting a lot of oxygen so it can thrive in that environment. Interestingly enough, the numbers of people with ADHD are growing for girls, and the largest number of people being diagnosed right now with ADHD are moms. Well, why would moms start to be diagnosed with ADHD? If we think about children, when they don't get enough sleep, they don't come up to us usually and say, Mom, I'm exhausted, I need to have a nap. They start getting hyper. They start getting out of control. They're snapping. They're irritable. They have low tolerance. And we deduce that they need to have a nap because of their behavior. And if those behaviors continue because they are not getting the sleep they need, they get diagnosed with ADHD. So now we look at moms who are managing stressful lives nowadays. Let's face it, we're working, we're raising our children, we're trying to do it all. And we are up half the time with our kids. We're not sleeping well. We may be sleeping beside a partner who snores all night, so we're not getting our sleep. And we are becoming more and more chronically sleep deprived. So what type of behaviors do we have? We have the same behaviors as those children who desperately need a nap, except we are socially blunted in how we carry out those behaviors. But, we're now being diagnosed with ADHD when really all we need is more sleep. So bringing it full circle, chicken or egg. These poor children with ADHD and autism, they don't get enough sleep, so their behaviors get worse. Why do they have it in the first place? Could it be that one of the contributing factors is that they did not get enough oxygen in the womb? It's something to think about. Can we help that? Can we help the next generation to fare better in this regard? And now how can we help these kids that have this now? The studies show that by intervening and affecting sleep, we are able to affect the behaviors of these kids. And wouldn't it be great if we could do that without more drugs and more problems for these children? That's what we're trying to do through FACE. So there are lots of organizations who stress sleep, and sleep is huge. But I strongly feel you cannot address sleep without addressing the craniofacial structure that supports the airway, that supports the neurological development, that gives rise to proper sleep. So that's where we are looking for you as parents, as providers in the community, let's start talking more about this. Let's raise awareness. Let's talk to our doctor. Ask them, what do you think about this? Talk to our friends and watch for women that are pregnant and mention it to them. It takes courage sometimes, believe me, I know, to go up to somebody and have these conversations, but the outcome for them is incredible if we can affect change in the development stage in utero. Wouldn't that be amazing? So thank you for listening. We're always here to answer any questions that you have. We are about to start our road trip to start raising awareness in your community. So if you want us to come to your community, reach out to us and we'll try to fit you in on our schedule. But let's start talking to our moms, okay? Let's start talking and having these conversations, because people are desperate out there and they feel very alone. They feel very judged. As a mother, first thing you think is, what did I do? What did I do? Why is my child having these issues? And that poor child is wondering why everybody is so frustrated with them, right? And so now, never mind what did we do, because we can't change that, but what can we do going forward? We can insist that our doctor do a sleep test on our child before prescribing any medication for ADHD. Before we put them on something like that, a medication that in many cases cause children to feel so negative that many of them have suicidal thoughts after starting these medications. I'm not anti, okay, but I am saying, first, let's check out why. Check for sleep first, because that is something that we can definitely help them with and have a positive outcome long term. So thank you for joining me. Thank you, everybody, for your encouraging comments. And please share this video, okay? Let's get this news out to moms and let's help stop the cycle, okay? Thank you, everybody. Have a great evening.